Hi, I'm Ellie Anderson, and on today's episode of Sick of It, we're going to talk about ERs and ER doctors. Now, many chronic illness patients have to be in the ER much more than the average person, and that can really be for any number of reasons. So, for example, I might have a really bad migraine and my rescue medications just aren't working, my TENS unit isn't working. So, I go into the ER to get IV meds made for migraines so that I can quickly get rid of it and not have to go days and days more with a migraine. Another example would be if I had a really severe ovarian cyst, it was just more pain than I was used to having. I may go in just so I can get help to get through that ovarian cyst because they can be really painful. Now, for some reason, ER doctors love to hate me. And I've heard this from a lot of chronically ill people across the board. They just don't like chronic illness patients. I don't know if they get sick of seeing you. I don't know what the deal is, but they assume that I'm there drug seeking, and that's never the case. So if anyone's ever had IV narcotics before, you probably know that they're pretty miserable. They're not fun to get. I'm not sure who the people are who are just dying to get those, but they kind of suck. And so to be treated like a criminal when I go in who's trying to get some drugs is just kind of silly to me because that's the last reason I'm there. If I can avoid those drugs, please, I will avoid them. So there was one time in particular where I was having a TIA stroke at work. And I had had a couple before, so I knew kind of what was going on. And I went and laid down in the back, and my boss went ahead and called 911 for me. The ambulance got there, they did the neurological test, they saw that I was indeed having a stroke or something of that nature. So they took me to the hospital. Now, TIAs are short lasting, so by the time I got to the hospital, my face and everything had returned to normal, but I was pretty out of it. After doing some tests, the doctor comes in and says, "What are you trying to get? What is it that you want? Is it drugs? I don't understand." And I just looked at him, so confused about what he's talking about. I don't understand. The ambulance saw me having the stroke. What do you think I want out of a stroke? What do you even get? Do you get something first? I don't think you do. Eventually, they cleared me to go home, which was really all I wanted. And once I was fine to go, I went home. But, in any time like that someone feels like they're in danger, that they could be having something that could permanently damage their brain, yes, they're going to call 911, they're going to be scared, and they're going to go to a hospital. That is the way any normal person would react. And just because I'm chronically ill doesn't mean you should treat me any differently. It got to the point for a long time where I just wouldn't even acknowledge that I was in pain if I was at the hospital. If they asked my pain level, I would tell them a low one, even though it wasn't true, just because I was so scared of getting labeled as that. And that shouldn't be something you're scared of. You should be able to be honest with how you feel at all times. It's not okay to suffer in silence just because a doctor or nurse or someone at a hospital decided to make a judgment on you that they shouldn't have. It's not okay to feel bad, to hide your pain just so you don't get judged as something you're scared of. It's time to stand up and advocate for ourselves. The hospitals have tried for a long time to stop the epidemic of abuse of narcotics, and I understand that completely. It's a serious issue. But it's gotten to the point where they're no longer helping the people who need it. Instead, just so worried about someone getting high, they're ignoring people who actually need the care. And that's a sad place to be. If you feel uncomfortable with how you've been treated by a doctor or a nurse or anything like that in the ER or beyond, there's a patient advocate at every hospital in every healthcare system, and their job is to listen to what happened to you and advocate on your behalf. Don't let that go to waste. If you're not comfortable talking to a doctor or nurse directly about how you're being treated or the healthcare you're receiving, the patient advocate is the perfect person to go to. It is their job to stand up for you. So don't suffer in silence anymore. Advocate for yourself and for all of us out here who are fighting the good fight to try to just be respected as patients like we deserve. As always, my wellness coaching for chronic illness is available on Fiverr. That's Fiverr. or you can find me on Instagram and TikTok at sickofitally. See you guys later.